Good morning and welcome to today's presentation, Ageism in Healthcare. Thank you for taking time out to be here. Some features and housekeeping rules for today. You are automatically muted. You cannot see other participants in the webinar and will only see the speakers and the hosts. If you have any questions, please feel free to put them in the chat box. We will be recording the session and it will be available after today on our website. And we will have further resources posted on www.centralanaaging.org. We would like to thank our sponsor for today, Novant Health. Today's guest speaker is Wendy Renedo. Wendy received a BS degree in nursing from the University of North Carolina at Charlotte, where she graduated summa cum laude. Wendy is the manager of well-being and resiliency at Novant Health. She is formerly the manager of clinical consulting in the diversity, inclusion, and equity department. So congratulations. She brings extensive experience in culture transformation of clinical areas. Wendy currently leads strategies and work that creates a culture where people feel included, engaged, and authentic while achieving Novant Health's goals. She is currently an active member of the health community, being featured by Fox 46 Charlotte, as starting her mission is to make sure patients are respected and understood regardless of their race, sexual orientation, religion, or cultural background. Wendy's background includes working in several areas of nursing, including critical care and medical surgical. She also worked on a corporate documentation team that developed best practices nursing documentation. She previously worked as a senior healthcare business analyst, where she looked at data across the organization to uncover opportunities for building a more diverse and inclusive work environment. In her analyst position, she also worked on health equity initiatives. Prior to Novant Health, she was a travel nurse and worked in Charleston, South Carolina, where she encountered people from different cultures that helped shape her passion for diversity and inclusion work. Wendy has also served on several ethics councils and committees throughout her career as a nurse. Wendy grew up in Charlotte, North Carolina, where she spent time riding horses and bringing home lost and injured animals. She currently resides in Concord, North Carolina with her 3 young boys. She has twin boys that were born premature and one that has special needs. Wendy is passionate about advocating for her son and others with disabilities. Without further ado, Miss Wendy Renedo.
Thank you so much, Candace, and thank you for that wonderful introduction. I don't know how I achieved all that since I'm only 25. Just kidding, I'm not. But I have been at Novant Health for 16 years. Recently, as of Monday, I am now the manager of nursing wellbeing and resiliency, which is an exciting role where I get to look at nursing burnout rates, compassion fatigue, and other concerns that we have for our nurses across the organization. Prior to that, like Candace said, I was the manager of clinical consulting with the Office of Diversity, Inclusion, and Equity. I've been doing that for 5 years, and prior to that, looked at data around diversity, inclusion, and equity for about 7 years. So been really doing this work, honestly, my whole nursing career, but for about the past 15 years or so. When we talk about diversity, inclusion, and equity, and I'm going to touch on equity specifically in a second, we really take time at Novant Health to define all 3 of those words, and they are part of our core values at Novant Health. So when we talk about diversity, most people think of race, ethnicity, language, usually religion and gender, but we really define that as so much more, and age is a big piece of that. We also like to include socioeconomic backgrounds, where you're from, where you grew up, all type family situations. All of those are really embedded in who we are. But today, of course, we're going to be talking about ageism. So you can go to the next slide. So at Novant Health, we started looking at health equity about 3 years ago. And in order for us to really see what that is and see how it can impact our patients and our caregivers, we needed to define it. So on the next slide, you can see what we have decided is going to be our definition of health equity. So the overall definition is the attainment of the highest level of health for all people. And so that really is the ultimate goal. But then you can see underneath how we're going to do that at Novant Health. So embedding our core value of diversity, inclusion, equity in all that we do, honoring each person as a human being with the right to healthcare and wellness, build community partnerships like this one, and presence to understand and address unique needs of all communities, and commit to providing access to care, demonstrate compassion, and promote well-being across our organization. Health equity is such an important topic, particularly when it comes to age. And I'm going to start by just defining ageism, but then I really want to talk about some statistics and why health equity is important when it comes to age. So next slide. So just so we can make sure we're all on the same page, I sort of just populated this slide with a few definitions of ageism. It can be defined in many ways, but these were the 3 that I felt were sort of the most relevant. So you can see we have prejudice or discrimination on the grounds of a person's age. And that doesn't just mean an older age. That could also be a younger age, or you hear a lot of people say, oh, millennials or things like that. Ageism occurs when people face stereotypes, prejudice, or discrimination because of their age. Again, one common stereotype is that older people are frail and helpless. Prejudice may also manifest in perceptions that older people are difficult and unpleasant. And it's a systemic form of oppression, but unlike other causes of inequity, such as racism, sexism, or ableism, anyone can experience it because we all go through most ages. Although it's universal, people do not always take ageism as seriously as other forms of inequity. And we're going to talk a little bit more about that. But I wanted to make sure we all sort of had a basic understanding of what ageism is, and then we're going to talk more about it. But before we do, I wanted to play this quick video that I felt like was a really good representation of ageism and combating it.
So what's this all about?
Can I say it again? So I'm too old for this.
You just want me to say what people say about me.
Weird question, I guess.
My teacher says you'll grow out of it. It's just a phase.
It was never a phase. I never grew out of it.
I guess I'm too reckless, I don't know.
People like to talk very loudly to me.
They say I don't think things through.
You're looking still good for your age.
I'll figure it out when I'm older.
You are having a senior moment.
When the focus is on my age,
Life seems to get a little bit harder.
It feels like I'm not given a chance.
I need to keep up.
Or get out of the way.
I lack experience.
Or too much experience.
I'm baggage.
Only weighing people down.
Looking at my age,
Like it is a disease.
where I work, no one takes me seriously.
it makes me feel powerless.
And it hurts.
When people see only my age.
Thank you for that, Candace. Okay, so I think that video is really a really good reference. It's also a great campaign if you want to check that out online. It's a really, really good campaign. There's more videos that you can look into as well as a website. So when we talk about ageism, there are several different types of ageism. And I did put those here on the screen. So I'm just going to quickly touch on each one. And the reason being is that some of the statistics that we're going to talk about on the next slide touch on a couple of these. So institutional ageism occurs when an institution perpetuates ageism through its actions and policies. So specific to healthcare, we're going to touch on that in a little bit, but there are institutional things that happen even in healthcare that can lead to ageism across an organization. Interpersonal ageism occurs in social interactions. Internalized ageism is when a person internalizes ageist beliefs and applies them to themselves. Hostile ageism involves someone having openly aggressive beliefs about age, such an example would be that teenagers are violent or dangerous. And then benevolent ageism involves someone having patronizing beliefs towards people based on their age, such as that older adults are childlike and require guidance with basic tasks. And so that's benevolent ageism. And we're going to touch on a couple of these and how they impact healthcare a little further on. But on the next slide, I always like to talk about some of the statistics that we've seen in research over the past 10 or so years. So I'm just going to read through a couple of these. So 82% of older Americans reported experiencing ageism regularly, and older for the purpose of this research study was over the age of 65. 65% experienced ageist in messages in media, which we see frequently, and there can be a whole nother presentation about media. And then at the bottom, we're going to talk about, so 1 in 6 people over the age of 60 report that they've experienced some form of elder abuse. Typically people think of elder abuse as physical abuse, but it can actually be so much more than that. So 1 in 6 is very significant and an important statistic to be reminded of. 1 in 5 Americans over the age of 50 say they've experienced discrimination in healthcare. So 1 in 5 Americans over the age of 50 say they've experienced discrimination in healthcare. That's also another very important statistic. As we know, as people age, they interact with healthcare more frequently and for different reasons. And so it's really important that in the healthcare industry, we keep our eye on this and stay reminded of the importance of paying attention to discrimination in healthcare based on age. Next slide. So I'm just going to touch on the workplace for a minute, and then we'll get back to healthcare in general. But this is a study that came out, and these are some just really interesting slides about the overall workforce today. And we do our own internal studies at Novant Health around what ages we represent and how this helps us interact with each other and the positives that it brings to our care of our patients when we do represent so many different generations. So in this study, this was U.S. workforce numbers, and you can see that it says 2% are considered in the traditionalist generation, 25% in baby boomers, 33% in Generation X, 35% in millennials, and 5% in Generation Z. So this is overall U.S. Workforce numbers. Next slide. So this is some slides that were put along with that's research. And so I just wanted to touch on these for a second. We're not going to spend a lot of time on these, but they do bring out some interesting points about different generations. Obviously, these are generalized. This is not specific to each person, but it does give us some generalized information about certain generations. And so on this slide, it's talking about baby boomers. So they define this as born in 1946 through 1964. And it says that 65% of baby boomers plan to work past the age of 65. 10,000 baby boomers reach retirement age every day. So one of the things that Novant Health that we're looking at is the fact that we do have a significant work population, particularly of nurses, that will be reaching the age of retirement. So how do we glean all the amazing information that they have and share that with our younger nurses that are just coming out of school? Nursing is one of those fields that the longer you've been in it, the more you know and the more valuable you are. And so how do we build on that and glean all of that great knowledge from our nurses that are wanting to retire and spread that down to our younger generations without losing them from our workforce in that critical time where we need their knowledge? There's some information on these slides that are general information about how employers should engage different generations. I'm not going to go through all that. I know you're going to see these slides. Some of it's great information, some of it's, but I do think there's some good information on here, particularly if you are an employer. Generation X here is defined as born 1965 to 1980. It says 55% of startup founders are Gen Xers, which have the highest percentage. And then by 2028, Gen Xers will outnumber baby boomers in our workforce. And that's not many years away. So it's important to know how to work with our Gen Xers. Some of the things that Gen Xers are shaped by and motivated by are quite different than baby boomers. So it's important to recognize those as employers and understand also how to engage them in shaping our even younger generation and using everyone to their max capabilities or excellence, remarkableness, whatever you want to say. So the next slide is, I think, millennial. Yes, millennials. So born 1981 to 2000. Millennials will probably, I think, you'll see a lot of information. People talk about millennials in the media and things like that. But it says 75% of the global workforce will be made up by millennials in 2025, which is not far from now. So it's really important that we know how to tap into millennials and how they see the world and how they are motivated at work. 15% of millennials ages 25 to 35 are living at home with their parents. So it's important to us also understand sandwich generations and things of that nature, which I didn't get into in this presentation, but it's great information to read about if you have time. Another thing that's on these slides is communication style preferences. If you are an employer, that's really important to note because everyone does like to be communicated to in different ways. And as these generations, these slides go past, you'll see that communication styles get more electronic and less verbal. So that's always important to note. Next slide. All right, Generation Z, born 2001 to 2020. Again, 40% of Generation Zers want to interact with their boss daily or several times each day. Every time I share that statistic, people are surprised by that, particularly our coworkers that are Gen Zers, because they'll often say, no, that's not me. I don't want to interact with my boss quite so often. So I think that's important to note that it's still being reported that 40% do. 84% of Gen Zers who expect their employers to provide formal training. That's a really good thing for employers to know when they're onboarding our Gen Zers is that they still want and expect formal training. You can see their communication styles have gone even more electronic here, but it is important to know a few of these things. And then the next slide, let's see. Okay, so I'm going to pause for a second and see if there have been any questions that I can answer before we go into how this is interacting with healthcare.
Let's see, I see one that says, do you have comparative research numbers of ages of working persons in other countries?
So I can add that to the slide deck when I finish that. I can add that. That'd be great.
Okay. Again, and another question was similar and from the same person. It says the slide is showing % of global workforce is millennials in 2025. Is that information similar for the US?
Yes. Yep. It is. It is very similar. but I can add those so that you all can take a look at those. I really like those slides just as generalizations. I think they're good. That website that's listed at the bottom of the slides goes even more in depth if you're wanting to look more at those numbers as well. Okay. So I want to talk a little bit about how this shows up in healthcare. And please continue to put in the chat any questions you have or feedback. And I don't think you can come off mute, but happy to interact as much as possible in this webinar. So a couple of things that we have seen show up in healthcare when it relates to age. And for this, I'm specifically going to focus on our older patient population. So one of the things that we hear a lot about is what's called elder speak, and that term has been defined more recently. But this is where we find healthcare providers, nurses, doctors, any care provider sort of using simple language or using terms of endearment like honey, sweetie, things like that. It talks about here about a rhythmic tone that someone may use for a child. So there's a lot of information about slowing down your speak, and I can tend to speak very quickly, so I apologize if I do that, because there's a lot of good information about why we should slow down our language for all people. But then there's where you go to the extreme of what is defined here as elder speak. So sort of taking it down too low, or assuming that because of someone's age, they can't understand you, or they might not understand the medical language that you're using. So that's something we really work with our team members on. Another piece, which is actually at the bottom bullet, but I'm going to go ahead and talk about it here, is when our care providers direct the conversation toward the person that's with the patient and not the patient. So oftentimes we'll see our older patients are brought, or someone comes with them, I should say. And so our care providers may direct that conversation to the person that's with the patient versus the patient. And so we're really working with our team members to remind them that the patient is who is getting that conversation. And we're so grateful that there's family or friends with the patient. We can include them in the conversation if the patient would like us to. But just because of the person's age doesn't mean they don't understand what we want to talk to them about or understand their care as a whole. So that's something we really work with our team members on. Another piece I like to talk about here, and I do a lot of education with our team members, is making sure we ask who is with them and ask if it's okay that the person stays in the room. A lot of times there's assumptions made of who's with you, and that could be, assuming someone's your wife or assuming someone's your parent or your child, etc. There's just a lot of assumptions that can be made. So rather than doing that, just taking a pause and asking who's here with you today, and then using that same terminology to describe that person. So if I'm the patient and I say, this is my daughter here with me today, then I would use that type of language, or a friend, etc. And then making sure that we're clarifying if the person can stay in the room while we describe treatment. Those are really important. We find as our patients age, that can get a little lost at times. So we just really want to make sure we're still continuing to encourage and educate our providers and nurses and caregivers to do that. So one of the other statistics that's out there, I think it was Kaiser that put this out, that talks about the fact that providers often don't assess or address suicidal thoughts in our older patient populations because of the assumption or the personal belief that this is part of aging. So it's just normal as you get older to think about death and dying, and maybe talk about death and dying. So we want to make sure that we are assessing this for our patients just like we would at any age. So we do a lot of education internally around that as well, and just making sure that we are addressing this and know that it's not a normal, I hate to use normal, but you can see here in quotes, it's in quotes, but making sure that we're not making assumptions that it's okay or normal for a person to think that due to their age. Another one that bubbles to the top in healthcare is that age determines your level of health. So in the COVID pandemic, you probably saw in the news, there was a lot of discussion about rationing healthcare. Not as much in North Carolina as in some other states, such as Alaska and Montana and Idaho, actually. There was a lot of information that was released around rationing healthcare during pandemics. We saw the highest rates of admissions and ventilator use that we had, well, at least in my lifetime. And so there was some discussion around that. So really getting to the root of bias and understanding that age does not determine level of health. So someone's age is not an immediate predictor of survival, although we did see, of course, in COVID that it affected our older patients at higher rates in the very beginning. So there was a lot of media coverage about that and a lot of work in healthcare around taking that bias out of assumptions and out of planning care and not having age dictate that. So I'm going to pause for a second. Okay, so I was reading a question. So it says, would you not also ask the role of the other person in the room? And so, yes, absolutely. I think I mentioned that. So yes, we would want to ask the role of the person in the room. So for example, if the person says, this is my daughter that's here with me today, you may want to say, and what you could say role or however you want to verse it. But I usually just kind of in conversation incorporate it in to ask questions like, how do you work together for your care? Or is your daughter going to drive you to your next appointment? Or I oftentimes don't ask their specific role, but I just sort of get that through conversation. And then usually, of course, always at discharge, if they're in the acute setting, always asking questions like who are you going to call if you need a ride to a doctor's appointment or a medication picked up, or is there a neighbor that can check on you, things like that, so that we can really get to a full understanding of who the resources are for that person that's being discharged. And then there is another one in the chat. It says implicit bias surveys are really enlightening. Yes, there are some great ones. So the link that's put here in the chat from Harvard has several implicit bias surveys, and they are fantastic. We use those extensively at Novant Health. So those are great surveys. Thank you for Cynthia for sharing those. And then let's see. In the transplant community for eligibility, isn't the practice of age built into that? Yes, that is true. So I personally have not worked in the transplant arena, but it is built into, particularly depending on the organ, I believe. And again, I'm not an expert in transplants, but I believe it depends on the organ. And there's a lot, I know there's a lot that goes into transplants and determining who is on the list and where and all of that. Unfortunately, I'm not an expert in transplants, so I'm not going to speak a lot to that, but yes, age is built into that questionnaire. Any other questions about that in particular, or any other things you've seen in healthcare with your own personal experience that you would like to share with the group? So we have I went fast. I'm gonna if anything else comes up in the chat, I'll address it. But a couple other things that we do in healthcare in particular. So I think I saw someone, so we do have geriatrics, geriatric practitioners, nurse practitioners, and things like that. So we do try to make sure that we are leaning on those resources. Again, particular for this one, we focused on elderly, but ageism can be any age. So in nursing in particular, I'll speak to that since that's the world that I live in. We see a lot of generational differences between new grads and our more seasoned nurses. And so that actually can present for both groups as well as anyone in the field. So a lot of the work I do in particular is getting those groups of people to see the positives and the resources that each group has to bring to the table. And really leaning on those with each other. So for example, as a seasoned nurse, there's things that I've seen in my career that a new nurse may not see for 10 years. But by bringing a new nurse alongside of me, I can teach her about the signs and symptoms and things to look for so that if she does ever come across it, she's much more prepared and able to handle that, what could be critical situation. And so those are things that we look at. And then our more seasoned nurses tend to say, well, you know, the younger nurses are able to help me with new ideas or new research that came out while they were in school, or they're able to fix my computer or things like that. So there's a lot of strengths that each group has. And so when I work with teams individually, so I tend to work with our nursing teams depending on their unit or their clinic, things like that. We try to focus on identifying those strengths and then using those strengths with each other. So ageism, again, can be across all ages. I know I touched on our older patient population on this slide, but we see it in younger patient populations too. In my bio, she mentioned my premature sons being born very premature. And what that's like to know that there's certain things in healthcare that, depending on the age at birth, may be offered and may not. So that happens as well. Okay, so I think there's another question in the chat. It says, what work is Novant doing to address health equity and medical bias experienced by marginalized groups such as Black elders and Latino elders and communities? That's a great question. Thank you for that. So we do have community partnerships. We actually, there's a team at Novant Health called Community Engagement that does a lot with that. But what we like to do particularly is focus on, or not focus on, but start with our research and our data. So that's a world that I came from. So we do like to look at our data. So that's one thing that we've done at Novant. And really focused on the past few years is making sure that all the data we look at is divided by elements of diversity. So race, ethnicity, language, payer, age, sexual orientation, gender identity. What am I missing? That might have been all of them. So anytime we're looking at data, so for example, if we're looking at pneumonia readmission rates, if you look at pneumonia readmission rates, we may look like at the surface that we're doing great, that our readmission rates are low compared to the nation. But then when we start looking at it by what we call real gaps, that's the way we sort of shorten it, we may realize, which we did several years ago, which was something I worked on. We realized that our African-American patients over a certain age, over the age of 65, were being readmitted at higher rates than our Caucasian patients. So when we broke it up that way, we realized we did have something we needed to address, and we needed to look at care. So that's the first step, is really understanding our data internally and understanding it by what we call real gaps. So that's one. And then once we identify something like that, we work on it internally. Of course, you may have seen the statistic about healthcare, but really in the acute care setting, we can fix, we can help people get to a place of well-being. But then if we're not assisting at discharge, then they're going to end up back with us. So really partnering with our communities in that regard. So things like this, and then community engagement does do a lot with our communities particularly with the Latino and Black or persons of color community, there's specific outreach. At the coast, we have an entire dashboard that we look at with all the coastal healthcare community entities. So not just Novant, but also the local colleges. And so, and I'm blanking on the name of that, Coastal Collaborative, I believe it's called. And that helps us connect our patients with more resources outside of just the Novant resources. And again, starts with sort of that data lens so that we can see where the need is, and we make sure that we can address those needs accordingly. So let's see, there's another question in the chat. Nursing homes, let's see, do you have any time? Yeah, okay, so this question is about nursing homes. Thank you for whoever put this here. So I would love to reach out and interact more with residential homes. And I'm sorry, I called it a nursing home, but that's when I was trained, that's what we called them, but residential homes. So that's been a passion of mine for quite some time. It's where I started as a CNA. And I would love to get more education out in those areas. You're right. We do see ageism in our residential homes at higher rates. I'm going to go out on a limb and say that. I don't have a research study I can put in front of you to say that. However, we know that our patients there are of our older generation and can experience some bias based in their healthcare. So I don't have a specific plan that I can quote to you right now. I would love to look into a partnership where we could have more education provided to our residential homes for the team members there. So that's something that I will definitely take as a takeaway because we do a lot of work internally at Novant Health in the acute care or the clinic setting, but not necessarily in residential homes or long-term care facilities. So that's a great question. And then someone says, Dr. Bill Thomas has done wonderful work in the area of residential home care. Awesome. Thank you for that name. That's great. I will try to connect with him. Okay, so if you'll go to the next slide, we're just going to touch on briefly a couple of things we can do at work. So this slide came from the EEOC, and so I'm not going to read it to you. But it does have some strategies out there if you go to the EEOC about ageism in the workplace. I can tell you at Novant Health, one of the things, and I touched on it earlier when I talked about the baby boomer slide and the fact that our nurses are going to be retiring at higher rates. So some of the things we're looking at is how can we keep them on as mentors? So not a 12-hour shift, not even an 8-hour shift, but how can we keep them on to mentor our new or newer nurses? And really tap into the skills that they have and the ability to bring things to the table that a new nurse grad may not see for quite some time. And a new grad doesn't have to be necessarily an age, right? So we're seeing people come to nursing as a second career. So it could be a new grad that comes into the nursing profession at 40 versus where we used to see, 22, 23-year-old new grads. So when I say new grad, I mean, right out of school, not necessarily an age. And then when I say seasoned, that just means usually over 5 years of nursing experience. So if you've been a nurse more than 5 years, typically you've seen a lot and can start mentoring other nurses in your field. So when I use those two terms, that's what I'm referring to. So we're trying to look at different ways that we can tap into those folks without just losing that experience and that amazing work that has been done. We're also trying to be sure that we are using people that are coming from other countries. So we are using international nurses more and more. And so that's another thing that we're looking at to help with our nursing shortage. And then, of course, there'll be even more nursing shortage as people retire. So there's a question in the chat and it says, do you have any information, opinion, or tips for people developing marketing materials that target info or resources for older adults? For example, fonts need to be larger, colors with great contrast, and how do you feel about using the words seniors or the elderly? Great question. So we highly use Microsoft's tools for not only vision, but hearing. So one of the things I should have said at the beginning of this is that we needed to have the words coming across the screen, the captioning, because that's very helpful, particularly for people that are hearing impaired. So we try to do that in all of our webinars internally at Novant Health. So we'll have the captioning. We do try to make sure all of our PowerPoints go through the ability screening that Microsoft has. And I think I'm calling that the wrong name, but it essentially looks at, do you have something that's a picture without a description, for example, to be sure that it is easily read or seen or used or experienced by all people. So I highly recommend you use those tools. Another thing you could do is we always try to make sure that multiple people on our team look at marketing materials or PowerPoints to make sure that we're using inclusive pictures and things of that nature. There's some great information online about ageism in media. And like I think I said at the beginning, you could do a whole presentation on that alone, but our media does target toward younger people. So there was a great YouTube video that I wanted to use, but it was far too long. And it was an experiment done where they wanted to do a marketing campaign and they had younger people picking out who should be used for it. And I'm using younger as in the term for the video, but it was a really good video. So it's out there on YouTube. If you just search ageism in media, you'll see that really, really cool video about that. So, but I do highly recommend that you use the Microsoft tools that are available. We're also doing mapping in our facilities currently at Novant Health. We're going to do it at every inpatient facility, and then it'll go to clinics. And it's not just it's actually, well, it's called disability mapping, but it particularly looks at vision, hearing, and mobility to be sure that not only for our patients, because that I feel like we do pretty well, but for our team members that they're able to access all of the places in Novant Health. Novant Health. For example, you may find in some older buildings, we have badge readers. Well, if you're in a wheelchair, you may not be able to reach the badge reader, for example. So those are some things that we're doing to look at. And then also, of course, also in that is language. So having pictures for departments instead of an English word. So using, a plus sign for the emergency department, things like that. So that's something that we are embarking on as well. As you know, we've developed or acquired the hospital at the coast, New Hanover. And so that we're going to start there because it is our newest owned facility. And so we're going to start with that mapping there. I hope that answers your question. So there is another question in the chat. It says here in Asheville, our Generation Plus program, part of Blue Ridge Pride, will be implementing a program similar to the Pride in Care, which focuses on well-being of LGBTQ elders. Love that. We are working with a variety of elder service providers in our region, hoping to have this up and running January 2023. Oh, that's great. And hoping to serve a variety of residence facilities and geriatric healthcare services. Ageism is a part of this program. Oh, that's great, Butch. That's awesome. So I do a lot in the LGBTQ space, LGBTQ plus space, I should say, particularly with our transgender patients, patient navigation, things of that nature. I love it when I see sort of a crossing of paths, so to speak, of two different groups and it's sort of melding those together in the concerns that both groups are facing. So I love that. That's awesome. Thank you for sharing. So we'll have to look for that in 2023, January. That's not far. Okay, so before I move on, I just want to pause for one more second and see if there's any more questions that come up in the chat, and then I will start closing us out. Okay. So I just want to, I think the next slide is just my email. So I again have moved to a newer role working specifically back with nurses. However, I still do a lot with diversity, inclusion, equity in the community on a volunteer basis. So if you need to reach out to me, that's my email. I greatly appreciate your time. Love all the feedback in the chat. I wish I could see all your faces so I could interact with you, you all better. But please don't hesitate to reach out if you there's something that you can share. Would love to touch base, hear what you're doing, interact with you as much as possible. So I appreciate it again, and thank you for having me.
Please consider joining us and look out for our upcoming webinars to be announced at a later date. Also, please save the date. I'm putting in the chat for our annual aging conference on Friday, October 7th. It will be virtual this year. For more information, please visit our website for more information. We do have limited sponsorships available. If you're interested in that, please contact Lindsay Tice or Katie Kutcher. If there aren't any other questions, everyone have a great day and a fantastic weekend.